This is a town hall event. It is initiated by the community, and we have invited a panel to speak to us and with us today. It is not a public health event. We are here to get informed about the COVID-19, also known as the coronavirus. We hear about it often on the news, and it's becoming scarier and scarier for some every day. Today, before I start, I'd like to give a thank you for Jason Ritz, the pastor, for allowing us to be here today at the Grace Evangelical Free Church. I'd also like to thank Sam Houston and the county for recording this live. It's live as we know it on the County of Lake Facebook page. We also have the public health here that are giving away sanitizer, lots of sanitizer, and flu shots. So please do not be afraid or weary of receiving a flu shot tonight if you have not done so this year. So let me go ahead and start. I'd like to introduce the panel. On the end here, we have Rob Young from Lake County Office of Education. We have Sheriff Brian Martin. Here we have the Lake County Public Health Officer, Dr. Gary Pace. Then we have Dr. Diane Page from the Chief Medical Executive from Sutter Lakeside Hospital. We have Teresa Campbell she is the Chief Nursing Executive, also from Sutter Lake Hospital, and the Tammy Carter with infection preventionist. She's the infection preventionist, also from the Sutter Lakeside Hospital. And finally, we have Jim Dowdy from Kelseyville Fire, Captain Jim Dowdy. Thank you very much. We'll go ahead and start with Dr. Gary Pace.
Good evening. Thank you for the introduction, and thank you for this opportunity to talk. So my name is Gary Pace, Public Health Officer for Lake County, and basically what I was hoping to do is give a quick overview and talk a little bit about the local situation with the novel coronavirus, and also talk a little bit about some of the health department's preparation and the contacts we've made. And then, up here tonight, there's a lot of expertise for specific areas here. The hospital folks are here, the EMS people are here, the schools here, and the sheriff's here. And so, there's a lot of ways you can understand some of the different preparations that are being made around the county. And then we hope to open it up for questions so that people can ask about some of the things they're concerned about if we don't cover it. So people are probably watching the news and getting things on the TV and in the newspapers about how bad this infection's getting. And it started in China, now it's spreading around to several other countries, and it's starting to be found in the United States. Right now in the US, there's been about 100 detected cases, and there's been 6 deaths that we feel like is due to the coronavirus. The issue with this is we've done very little testing in the United States. The testing was going through the Center for Disease Control, the federal agency, and they've had a limited number of tests, and they've been very specific about the kind of people we were able to test, and they were very sick people, mainly that had contact with folks from China or other places where the infection was known to be. So we don't really know how widespread the infection is in the community. You're going to see, I think, over the coming days, more and more infections popping up. There's a bunch more testing that is going to be made available so that people will, we're starting to get it, we will soon be getting a better sense of how widespread it is in the community. Today, a case was found in Sonoma County that was on one of the cruise ships. There's been people in some of the other surrounding counties, Napa and Humboldt, that were mainly travelers, but it has been, you'll see a lot that's coming out now about what's going on in Washington State, where there's been a few deaths up there in the nursing home, and it seems to be out in the community fairly significantly up there at this point. So part of what I just wanted to point out was that the strategy up to this point from the federal and the state experts in this has been to try to limit travel into the country from people coming from high-risk areas, and then if anybody was suspected to have a problem or to be infected, then they would be quarantined and isolated. So this is called a containment strategy, where you're basically trying to contain the virus so that it doesn't spread out into the community. This is a long-standing public health strategy that's worked some in the past, but once the infection kind of seeps out and gets out of the containment, then it's out in the community, and that strategy doesn't really work that well anymore. And we're at the point where we're shifting now to more of what we call a mitigation strategy, or you're not keeping the sick people out, but it's in the community, and you're trying to limit the spread within the community. And I think some of the folks up here tonight will talk about some of the specific steps that individuals can take to limit the spread, because there's a lot that can be done. We've been getting a lot of questions from people about, can we travel? Is it okay for my kid to go to school? Does it make sense to have a public event like this tonight about coronavirus when you're kind of discouraging people from being in large groups? And so these are all the kind of questions that are important, and it's going to change over time, the way we think about it. I think right now the risk in Lake County is very low, that we're not aware of any cases out here. We're not aware of any of the infection being in the community, although I wouldn't be surprised if it is. We haven't really tested because nobody's met the criteria here. The issues with the schools will be talked about. The issues with the ambulance services and how the hospital's preparing is going to be talked about, and the sheriff will talk about their preparations. But, I think you're also going to see that in some of the neighboring counties, they're starting to declare emergencies or health emergencies around the coronavirus. We're not at that point in this county yet, but it's something that may emerge over the coming weeks as we see how things go. Basically, the strategy again is going to be trying to limit the spread as best we can. The treatment, there's really not treatment for the virus at this point. There's not a vaccine, but there is supportive treatment. So if somebody gets quite sick, it's a respiratory problem. So most people are getting sick with lung problems, and so that if you get quite ill, going to the emergency room and getting evaluated at that point is appropriate. And the treatment, while the treatment can't cure the infection, it can help support you during the problems while your body's trying to fight it off. I don't know. Maybe what I'll do is pass it along, and then.
Yeah, let's go ahead and have introductions of each person again, and just talk about what they do.
Okay, so.
Please. So we could start with Sheriff Brian Martin, and a quick introduction of.
Sure. Thank you for hosting this meeting. My name is Brian Martin. I'm the sheriff and also the director of emergency services in Lake County. I'm not going to go into a whole bunch of detail at this point. If questions come up about what our plans are in response to this possibly affecting Lake County, I think from what I'm seeing, I don't have any special news sources. I hear about the developments as they go on, just like everybody else in public, from news reports, listen to the radio, information on the internet. So we are responding pretty much with the same information that the general public is getting. We don't have a secret source of information. From what I've seen, the CDC, the California Department of Public Health, our local health officer, and our local health providers have been very transparent in how these are rolling out and affecting our communities. So our response was to develop a protocol. We reached out to some of our neighbor agencies to talk about what they were doing and see what their responses were going to be in their jurisdictions. As Dr. Pace said, some of the other surrounding agencies have already declared states of emergency. So we wanted to make sure that we're prepared in what might be something inevitable. This might affect every community within the state to some extent. We hope that it's not a major outbreak, but we definitely want to be prepared for that. So with that information, provided guidance to my staff to start developing protocols, look at our individual preparedness. We're good in this county as far as responding to emergencies and epidemics. Everybody that's lived here for any length of time has dealt with some sort of emergency, and this is just another emergency. It's different, but that's all it is. It's just a little bit different, and our response is going to be a little bit different. So our protocol and our response, it kind of surprised me when I read it, because the first thing that I saw, the first priority was to protect our employees and their families. And I thought, well, aren't we in the business of serving the public and protecting the public? And as I got a little bit farther into it, I realized that if our employees and their families are sick and they're affected by this, we can't deliver services. We can't have that continuity of government services that we need and that people expect during these times of a disaster. So our number one priority is actually to make sure that our employees stay healthy, stay safe. We do this by providing them guidance and education, just like we'll provide everybody else, and make sure that they wash their hands. If they get sick, they stay home sick. If their family members are sick, they stay home and don't bring those germs into the workplace. People expect that just because we have some incident that the government's not going to close down. We still have to have those people available to provide services. So the rest of our plan dealt with how we're going to conduct emergency operations, cross-training of staff, making contingency plans for rearranging schedules and deploying personnel from less essential operations to more essential operations. And finally, probably the biggest challenge that we might have is if there were a situation where people were quarantined. The public health officer actually has some police powers outlined in law where he can quarantine somebody. And violating that quarantine is a crime. It's a misdemeanor. And we would be the enforcement arm if that came in. Hopefully it wouldn't happen, wouldn't get to that state. Hopefully people would voluntarily comply with quarantines. But if it got to a situation where you had somebody that we knew was a carrier of this and posed a threat to public safety and public health, we would be the enforcement arm of the public health office. With that, I'll leave it to the next person if there's any specific questions about what our protocol says. I'll be happy to answer that. My intent is to make our protocol available on our website so people can look at it and also share it with other government agencies in the county.
Thank you, Sheriff Brian Martin. And before we continue, I just want to make an announcement. Hay alguien aquí que habla español que quiere traducciones. Discúlpame por decirles así, pero no hice no hice la pregunta antes. Entonces, por favor, si hay alguien, levanta la mano. Gracias. I was just asking if anybody wanted translation services. Go ahead, Rob.
Okay.
Thank you so much. Excuse me.
Hi, my name's Rob Young. I'm the Emergency Preparedness Coordinator for Lake County Office of Education, and I coordinate liaison between the County of Lake and our school districts when emergencies and other things pop up. We've been here once before. I remember back in 2009 when the H1N1 came through to our county, and what that did was kind of force our schools to look at and developing a pandemic protocol. So a lot of that stems back to just implementing some universal precautions, making sure that we're putting in some extra cleanings, identifying the common surface areas that we're cleaning to make sure that they're clean, get rid of any kind of germs, things like that. If they're ill, to stay home for a 24-hour period of time, and really following the advice of public health as we move forward. We keep in constant contact with public health, especially if we have any kind of spikes in our attendance data at our schools to inform them when something like that happens. And so we're constantly monitoring our data to let everybody know, hey, we've seen a spike here. We let public health know that so that we can start to look at that data and break it down to see how many kids are actually experiencing flu-like symptoms, or are kids staying at home for other reasons, which was one of the cases with the swine flu, H1N1, when it came through. It wasn't so much that the kids were sick, but more of a fear of our kids getting sick, and a lot of parents kept them home at that time, which was really hard for the school and the kids and everybody in the class and things like that. Schoolwork, so if we did have an outbreak here, I know our schools are prepared to offer students independent study or makeup work, as appropriate. And that's important because we want to make sure that our kids are continuing their education even if they are sick or once they start feeling better, because if they actually were sick with the coronavirus, there may be an extended period of time that they would be out versus just the 24 hours plus, after their fever reduced going through. And then really, we wouldn't talk about school closures unless we had Dr. Pace and or the County of Lake, Public Health Department there and having conversations about what direction we need to move. But we would definitely, that would be a conversation that would be had at a different level.
Thank you very much.
Dr. Diane Page, I'm the Chief Medical Executive at Sutter Lakeside Hospital. I'm going to talk a little bit about the virus itself. Teresa, our Chief Nurse, is going to talk about our Sutter Health Emergency Medical System. It's been activated ever since the coronavirus really came out. She can talk about the extensive history and experience and support that we have from the system to be prepared and remain prepared. And then Tammy Carter is our infection preventionist, and she can talk about ways that we are very used to keeping infections from spreading. It's something that we have expertise in. It's what we do every day, but also to specifically talk about things that we are doing and that you can do to help prevent the spread of the virus, which is really the key to managing any type of a new bug that comes out. So the first, Dr. Pace had called it the COVID-19 a novel coronavirus. Most common cold viruses are from the family coronavirus. It's an old type of family. It's called coronavirus because of the way it's shaped. It has these little projections on it that make it look like it has a crown, hence corona. What's a little bit different about this one is it's very light. So most other flu viruses or cold viruses, if someone sneezes, unless you're right in front of them, you're very likely to not get infected just by breathing the air. Most of the viruses you sneeze out and they're heavy and they drop. And so your most likely way of getting them is by touching things and picking them up. And so with this new virus, it's light. And so you sneeze and it tends to hover and stay in the air. That's why you see a lot of people wearing masks. The masks help prevent people who have a cough from spreading it. They don't particularly help you from getting it, but that's why there's advice about not being in crowded places where people are sneezing. But one of the things you can do in your home, and one of the things we know about the coronavirus, is it's very easy to kill once it gets on a surface. It will respond to almost any cleaner that says it kills viruses. In fact, we saw an article today that there was 139 products out on the American market. Very common names that you know: Purell, Pine Sol, Lysol, things like that. If on the label it says that it kills viruses, you can keep your surfaces clean. There tend to be surfaces in your home that you touch a lot, and Tammy will talk about the types of ways you want to think about keeping things clean. But there is no dearth of hand washing, and Dr. Pace is going to demonstrate the proper way of hand washing. So this is a hand sanitizer, and when you wash your hands with sanitizer or soap, if you're washing with soap and water, you want to wash it for about 15-20 seconds. But with the hand sanitizer, look at what a good job he's doing. He's getting in on the webs of his fingers. You don't just want to do this. The viruses like to stay in sticky places. Think about when you get your hands all dirty. Where do you have to scrub to get them out? There you go. Yay, good.
And a little on your fingertips.
And the other thing if you keep your office space, your home clean, and be much more vigilant now than usual. That is very, very helpful. And then trying to stay out of places where people are sneezing. You might notice that at SFO they talk about how they're using electrostatic antiviral sprays. It's because they want it to hang in the air. So if you can get to it, it's easy to kill. But that's why there's a little bit of more of a heightened concern about it, because it's a little bit easier to pass on than just the regular flu viruses that we have. The other thing is it does present a little bit differently than the typical flu or common cold. Most of the time you'll have fevers and aches and your runny nose and you feel horrible. This one, it starts with a cough, often sometimes shortness of breath, and then the fever. Now that's a typical presentation. Of course, it probably can present in other ways at other times, but it has a very specific presentation. And when Dr. Pace talks about people who qualify for being tested, if you haven't had specific symptoms and specific exposures, you're very unlikely to have it, and we're not going to do the test. The testing, what tests are available is very fluid right now. Right now we're sending a lot of things to the CDC, and you'll know more than we will about when they'll actually be more available. So the current recommendation from the CDC is that if you are sick, and even if you know you have this, the best thing to do is to stay home. If you're sick that you need care, you need to call the hospital or call your provider. You want to make sure that they know that you think you might have it, so that they can make plans for it. Often what they'll do is make sure that you have a mask so that you're not coughing and spreading the particles in the area, and they might even have you wait in the car until it's time for you to be seen. The other thing, especially because we were talking about keeping employees safe, we want to make sure that you have doctors and nurses and all of the other people that are in the hospital there and the clinics there to treat you, is that we might be doing a little bit of self-protection overkill. So it might look scarier than it actually is, but we want to make sure they might be wearing masks, or we have, they're called PAPRs, which look like the hazmat gear. That we're very used to using, but we might be protecting ourselves a little bit more than usual so that we don't have any exposures locally. And it's not because we're worried about that there's this huge amount of virus to expose. It's just that one person out in this county is a very precious resource, just like a police officer were to, or a sheriff were to be out. You know, it's a big deal. And so, the other thing I want to talk about is many of the infection prevention measures in the hospital are things that physicians and nurses are very used to. People come in sick all the time to the hospital, and it is our duty and our expertise to not pass it on to anyone else. It's something we do every day, we're experts at. Much of it is with hand washing, and much of it is with knowing which types of diseases and what types of containment and isolation that patients need. So the way that this virus is working, the airborne part is similar to the way we treat patients that we suspect having TB. So we all have the equipment, every year we're trained on it. This isn't a new type of skill that anyone needs to learn. It's just that we need to be ready to possibly use it more frequently. And with that, I'll pass it on to Teresa, who can talk about the actual hospital and system response, emergency response and preparedness.
Before you start, Teresa, there was a question about, or more a concern, and it said, extremely worried about the quality of healthcare during this outbreak and the ability for our services to do a good job. So if you could possibly express what you're going to say exactly, we'll touch on that. Thank you very much.
So I'm Teresa Campbell. I'm the Chief Nursing Executive at Sutter Lakeside Hospital. And we are very familiar with these types of viruses. This is a new virus for us, novel, COVID-19. However, as Dr. Page was pointing out, we train for the use of the proper personal protective equipment. We call that PPE. It's an annual requirement that we observe, and people actually demonstrate that they know how to use this equipment, which we use throughout the year, depending on what types of patient exposures we are working to prevent spreading. We have special rooms that we test on a regular basis to make sure they have negative pressure, so that anybody that's in that room with any kind of a virus or a bacteria that would spread, it doesn't spread out. We test those rooms, and we test the airflow in those rooms on a regular basis. In fact, every time we have visiting regulatory groups, we demonstrate to them our compliance with that. So kind of addressing how we have the expertise to care for these patients. And if patients should require a higher level of care than what we are able to provide in our hospital, then we will work with, in this case, the Public Health Department, who will coordinate with the CDC to move those patients to an area where they can get a higher level of care, as we do with anybody who comes to our facility today that requires a specialty that we can't keep in our county, so we may need to transfer a patient. And that would require some support from our transportation agencies, which is the fire department in our case. I want to talk a little with you all today about what we call the Sutter Health Emergency Management System. And unfortunately, in recent years, because of our fires, we've had a lot of experience working with our system's emergency management group. And they have been great supports for us in obtaining equipment, supplies, transportation support, whatever support we need beyond what we have here in the county or in our hospital, we are able to convey to SHEMS, we call them SHEMS, Sutter Health Emergency Management System. And they provide us with the support we need and get us the supplies we need should they exceed what our in-house resources are. And that's been as far as HEPA filters brought up from Santa Rosa when we've had a lot of smoke in the facility or preventing smoke from the fires, to getting additional expertise on site, getting nurses if I'm running short of nurses. So within the system, we support each other within the Sutter Health system to support our needs for healthcare providers, for healthcare equipment and healthcare supplies. And of course, you see on the news that masks are at a premium because people think they need to wear these masks to prevent themselves from getting sick. And that's creating a challenge for the whole healthcare industry. So I would ask everybody to be conservative in your use and purchasing of masks, which may be even difficult to find here in Lake County. Because we're at a low risk, as Dr. Pace pointed out, I think it's really important to know that the best thing we can do for ourselves is to follow the rules that Dr. Pace was talking about. That's why one of our Sutter Health folks brought up a bunch of hand sanitizers. We have these too, but the really nice ones that you spray, and you saw good hand washing. One thing I'd add about the doctor's hand washing is you always got to make sure you're doing this too, because you want to get those tips of your fingers clean too when you're washing your hands. But hand washing is the #1 prevention. Tammy will tell you that. I want you to know that we get probably 20 to 30 at least emails a day from all the various agencies with all the latest information on what's the next steps, what's the strategy, what prevention modes should we be using. So we probably, in this instance, in my experience, and I've been a nurse 41 years, I've had so much more information coming in relation to the novel coronavirus or COVID-19, that it's amazing. There's more information almost than you can keep up with. But it's a high volume of really high level expertise. And I want you to know that at Sutter Health, one of our infectious disease physicians is on many state panels and committees, so we have really high level expertise coming to us through the Sutter Health Emergency Management System and with Dr. Silvers, who is our system infectious disease expert. And we also have access to a local physician who supports us and many other specialists who help us understand what we can do different or better with this type of a disease process. So tons of information coming from the CDC, coming from Calhang, coming from the Public Health Department, coming through our infectious disease preventionists. So much information from so many levels of expertise. I feel really very well informed about this virus and what's the current state of what we're doing to prevent and protect our patients and our staff. It is true that if staff get sick, we in a small county are going to have a harder time staffing up to cover that sickness because there's only so many nurses and doctors. So it is our responsibility as administrators in our hospital to prevent our staff from getting sick. And we do that by trying to prevent you guys from getting sick too. So Tammy's going to talk a little more. I do want to make one more point. We work really closely with all the agencies at this table. And that's a really nice thing about living in a small county because we probably have a lot better relationships. I met with half of the people in this room today in an earlier meeting. So I'm grateful that we have those partnerships and collaboration because that helps make our county safer as well. So I'm going to pass it off to Tammy Carter, who is our infection preventionist. And if she doesn't know it, I don't think anybody knows it.
Thank you for that vote of confidence. My name is Tammy Carter, and I am the infection preventionist for Sutter Lakeside Hospital. And I wanted to talk briefly about what is our primary goal as a hospital regarding protecting both you and ourselves. I guess I got too close. You and ourselves from the coronavirus. As Teresa indicated, our #1 priority is that our staff will remain healthy and not have the virus so that we are there for you when and if you need us. So if you do see us with, it's called a PAPR, as Dr. Page said, and it does look like you are part of a hazmat team. But what that does is it prevents airborne illnesses to get into our staff members, and that way they're protected and able to care for you and take care of their families. So our primary, what we are doing is, the first thing we do is we isolate, or we identify, then we isolate, and then we notify the public health department. So when you walk into the hospital, you're going to see signage that tells you if you have a cough or fever or shortness of breath, you need to let somebody know up front, and we will give you a mask. The most important thing to do in order to prevent the spread within the community is the person who is sick to wear the mask. Unfortunately, because it is an airborne disease, it will not help you to wear a mask unless it's a special airborne mask, which most public do not have, and they have not been specially fit tested on it. So the most important thing is we will put a mask on that patient, and we will isolate them within our isolation rooms and treat them that way. We'll do an investigation and see whether what the information is to where they were exposed. We call the health department, and they will give us directions as to where to go next. The screening, we are screening as per CDC guidelines, and that is guided through Dr. Pace and his team. We do have signage. We want to make sure that when you also know about cough etiquette. So if you are either out in the community or in our facility or any healthcare facility or anywhere, make sure that if you're going to cough, don't cough into your hand, because remember, your hands are going to touch everything. And there usually isn't soap and water available to you. And I don't know about you, but I do carry hand gel everywhere. My husband just teased me recently because I had 3 containers with me in my purse. But when you go to cough, make sure that you cough into your elbow. So you're going to cough this way because you're not touching everybody with your elbow. And if you aren't able to do that, have a Kleenex. Cough into the Kleenex, throw it away immediately, and then gel or wash your hands. And that's the best way you can prevent any kind of spread. If you have any symptoms, remember to stay home. If you need care, there's a difference between having a bad cold and you're at home and you need to take care of yourself. But if you are getting to the point where you need additional assistance or you need the hospital to take care of you or your provider, your doctor, what you need to do is call first if you can. Call first and say, this is what I'm experiencing, and this is where I believe I have been exposed. And that way we can arrange for you, if you are medically stable, we can arrange to meet you in the car with a mask so that when you do come into our facility, we are protecting the other patients, we are protecting the staff, and then we'll place you in isolation where you will be able to take that mask off, and then we'll be the ones that will be wearing the equipment. So that's number one that's important. And we are, like I said, we are working closely with the public health department. And I think that's about it right now.
I do want to emphasize a couple of other points that Tammy and Dr. Page mentioned, but I want to foot stomp. You know, you don't get the coronavirus without an exposure opportunity, and that's why we say the risk in this county is relatively low, not that it doesn't exist. People can travel and come into our county all the time. However, I just want you to be aware that so far we haven't had any person-to-person transmission that we know of, right, in this county, so that's a good thing, because person-to-person transmission is how it spreads. And if we keep doing really good preventive measures, cleaning the surfaces in your areas, the high-touch areas, your light switches, your doorknobs, your computer, your phone, probably the most disgusting thing we carry is that phone. Clean it with a virucidal, something that kills viruses. Any of the wipes in the store that you could buy say they kill viruses. And you don't need wipes, you can use paper towels and Pine Sol, you know, you don't have to have fancy stuff. I think it's really important to foot stomp those things. And if you're sick, stay home for goodness sake. Call the doctor's office. We'd way rather have a call than have you come in and have a waiting room full of people get exposed to whatever it is you have. And if you haven't had your flu shot, they're here at the church. If you're home watching this, come to the church and get your flu shot because a flu shot's going to protect you against the flu, which is more common right now in our county than coronavirus, thank goodness, and please let it stay that way. But use your preventive practices, you know, do the cough etiquette, have tissues, have hand sanitizer, I can't say that enough, and then call us if you think you've got some symptoms that worry you, because we'd like a call.
Hi, my name's Jim Dowdy. I'm a captain, a paramedic with Kelseyville Fire Department. As they were talking about the EMS, the ambulance service in the county is fire-based. And we have training we've been dealing with these type of things for years. I mean, we've been going back to 2002, all the different viruses. It seems like about every 2 years we seem to have some new virus that comes about. But usually the treatment and the policies are very similar. But all of our crews are required to have training, such as the hospital staff, every year to deal with this type of stuff. It's required through the state, and all of our paramedics and EMTs follow that training. We also have policies for our crews to, clean the equipment after the calls. Every shift usually cleans at the beginning of the shift after each call. So we're very diligent in keeping our equipment clean, and so we're not spreading in any of that manner. We also have all the personal protective equipment that we need. We carry in the ambulances and on the engines to keep all of our crews safe. We'll be working with the hospitals. We work with the hospitals on a daily basis. So if we do have a case, we can do early notification to them, isolate that patient, isolate that crew and that ambulance to prevent spread. And we do have policies on that. In a case that we have to transport a patient out of the county, we do have policies on that as well. And we will work with the different agencies, the health department, CDC, the hospitals to mitigate that situation as well. So we're all very prepared for this. We deal with the flu type calls on a daily basis, which is way more relevant than what any of this that we're dealing with here. And based on all the cases we've had in the past, it's usually not as bad as their typical flus that we get on a seasonal basis. But all the crews are prepared for it, all the equipment we have are prepared for it, and we have all the training to mitigate it. And as they were saying, we're getting more information every day on this stuff. There's constant emails going through every day. And the CDC's updating us, but there's a lot of press out there that and it scares a lot of people. So that's why we're having this meeting tonight, to educate everyone and just remain calm in this situation, because it will pass like everything else does. So, thank you.
Hi.
Can I say one more thing?
Oh, please.
So hi, I wanted to say one more thing before we go into the questions, which is sort of to lay the groundwork for what may be coming. I think people will be seeing some increased activity with the coronavirus, especially in the Bay Area around here. There's an outbreak that's happening up outside of Seattle now, and so you're going to see that there's a lot of kind of fear and sort of restrictive activities going on up there. There may be some of that going on in the Bay Area in the coming weeks. We don't really know, but I think the way to think about this is there will probably be pockets of problems, and then there will become fairly intense kind of interventions going on there, whether it's decreasing large group activities or trying to get people to stay home more often or things like this. It doesn't mean everybody needs to do that everywhere. One of the advantages of living in a small rural county is you're pretty removed from a lot of the spread of these kind of infections. And so the main thing I just want to point out is that we will be seeing increased problems in different areas. It doesn't mean everybody needs to really have a high concern every place. And I think as you can see, we're all paying a lot of attention to this and talking to our larger organizations and regional organizations, and then we'll be huddling up and sort of deciding, does it look like there's more problems here and that we need to take more activity or not? And we're kind of constantly gauging that and sort of balancing between disruption of normal life and infection prevention. But the folks here from Sutter really had a lot of great information about how to protect yourselves and your family, and then we're kind of collectively thinking about how to protect the community and what kind of institutional changes need to be put in place. So I just want to put that.
Great. Thank you, everybody. So I'd like to take this opportunity for those who are here who would like to come and ask a question. You can go ahead and use this microphone here. Also, we have a couple questions that came online, but one of the questions was the issue about Healdsburg right now and the outbreak. Could you call it an outbreak in Healdsburg? And you kind of answered it now about the pockets and how important prevention is.
What I'm aware of from what I heard this afternoon was there's a case in Sonoma County, so that may be Healdsburg, I'm not sure about that, that was related to travel on one of the cruise ships. And so they're gonna go ahead, what they're doing, what they have been doing. Does anybody know anything different than that? No?
Wasn't there something about the school, Healdsburg School? I thought I read something about one of the big, somebody.
Private school closed.
Let me look and then I'll get back to you.
All right. Well, meanwhile, there's another question about a hotline. Is there a hotline available right now in case, or would it just be 911 or?
If somebody has a question or if somebody's sick?
Either, a number that they can call.
I
with
think if somebody
fear or
has
questions.
a question about what's going on in the community, I mean, so that's a good way to get information. The best way to get the best information right now is through the Center for Disease Control website or for the California Department of Public Health website. Those are some places that do have very good up-to-date information. The Center for Disease Control website is really good for specific groups of people and recommendations for them. So there's a page for EMS providers, there's a page for law enforcement providers, there's a page for recommendations for school, there's a page for acute care hospitals. And so if you're interested in like there's a page for how businesses can prepare. And so so whatever your area of interest is, or you can go there and get a lot of information that's the most up-to-date, and that's the official word that's mainly being filtered down to everybody else. They talk about how you can prevent infection in your home, what travel, so can you go to Costa Rica for a visit? Is that okay to do now, or is that a bad idea? Can you go to Iran? Well, you can't go to Iran anyhow, but but I mean, those are the kind of things that they have the information on the CDC about. On the website. So that's a great place for the information. If somebody has a question and they, just a kind of a general question about the community or what they should be doing, the health department is a good place to call. So Lynn over in the corner is our communicable disease nurse, and she's very good and very nice. And so you can call and she'll answer your question. If she doesn't know, then we kind of go up the ladder. We have contact to the people at the state and federal areas. So, the hospital probably, I don't know, you can answer better, but I would suggest you probably think about if you're sick and you need some advice about how to deal with your clinical situation, talk to your provider or talk to the hospital. I don't know how you want to address that at all.
Yeah, I agree. I mean, it's the exact same. You're exactly right. All of our recommendations are very much coming from the CDC, but also augmented by the expertise of Dr. Jeff Silvers, who is infectious disease physician at Sutter, who leads most of our infectious disease efforts. And the recommendation is that if you're sick, that if you have a physician, you call that physician's office and tell them and talk to them, as opposed to showing up unannounced, so that they can help make a plan. And that if you don't and you need to go to an emergency room, to call and say, this is what's happening and I feel like I need to be seen, and it helps them prepare. They'll know what you look like or what your car looks like or something like that, and can help make sure that not only that you get the right care, but that they help protect other people from spreading the virus.
Yeah. So basically, if someone thinks they're sick, they could call 911 or go to their physician, but be prepared to let them know that they're coming and that they might be sick. That look, I'm having symptoms, this is the case, be prepared for me.
Yeah, because it's, again, like I was talking before, is that the symptoms are rather specific. It's a cough followed by a fever you're pretty sure that you had an exposure. So it's not just a runny nose and aches and usual flu symptoms. It's a specific symptom complex. And so being able to have
exposure.
Yeah, so, and I think that that's the question right now, right? So if you traveled from China, then you're on the list, CDC list that you have technically been exposed. Whereas right now, what we're trying to figure out is, are there people who have traveled and have come in and been exposed, but they don't know it? And we don't know it, and that's the reason why the recommendations for not being in crowded places is such. So this what I'm about to tell you is true for any virus. This isn't just coronavirus or novel coronavirus, but most people, before they actually get symptoms and are sick, so they actually shed the virus. Usually the day or two before you actually get your symptoms is when you're shedding the virus the most. And that's how viruses spread, right? If the only people that spread the virus were people that were coughing, we'd probably be able to contain things like that. That's the reason why viruses spread, and that's why it's so important to be vaccinated against the flu. Being vaccinated against the flu decreases the chance of actually having a full-blown infection in your body, which means that you're going to, even if you do get infected, what you shed or what you could breathe out is much less. That's why the flu vaccine is one of the reasons why the flu vaccine is so important. It actually helps prevent you from getting infected. It doesn't prevent the virus from getting in you. It helps. That's like one of a bad phone call, right? So one, get your flu shot. But two, right now, the CDC is recommending if you've traveled to certain countries, and those countries are China, Italy, Iran. So there's a couple of other ones, and so it's if you think you might have been with somebody who was exposed, that is something that you can talk to your physician. Everybody has the list. They're going to bring it out, and they'll ask you. But it's better to be safe than sorry. So.
Thank you. There was a question about a quarantine center. Is there a quarantine center available, or?
I can do it. You want to? It's good to have you.
So as I said earlier, in these types of situations, if there's an emergency declared or if there's a threat to public health, the public health officer has the authority to issue quarantine orders to individuals or actual groups of people or certain areas. I would imagine a lot of the response that I've seen is quarantines that are issued to individuals, and what ultimately the ideal situation would be that people self-quarantine and they stay in their own home. If it comes to a situation where somebody is refusing to honor and abide by the quarantine situation, then we could take them into custody as part of our police powers. Of course, if this were to become a widespread epidemic, we don't have the facilities and resources available for that. And what I'll tell you right now is we don't anticipate and we don't have plans in place for a large-scale involuntary quarantine at this time. Most of the quarantines that we're seeing, I think people are voluntarily abiding by them. People are reasonable, and they don't want to be the cause for somebody else getting sick with this illness if they know they have it. So our first goal would be self-quarantine in your own home where you're the most comfortable, and you stay there. As far as large-scale quarantine locations, I don't think we're not at that point right now in Lake County where we have enacted any plans for such a thing.
Great, thank you. Yes, sir.
My name's Bill Kearney. I'm a pharmacist, and I had a couple of questions for Diane or a medical person. One was, and I think you might have answered this, can you transmit the virus before you're symptomatic, before you have symptoms?
Yes, you can transmit any virus before you're symptomatic. So most of the time what will happen is if you were exposed to a virus and then you got infected by it. So not everybody that's exposed gets infected. Some people's immune system fights it off. But because this is a new virus to us, many of us don't have antibodies that fight it. That's why there's a heightened concern. So if you get infected, once you've started to develop symptoms, you've probably been what we call shedding the virus for a day or two. And so that means that if someone's in close contact, and this is close contact, not this.
Yeah.
Right, this is close contact. Actually, you're safe. So you're talking about family members, if you're a caregiver, people that you kiss, hug. those are the types of people that can get it in those early days. So you do need close contact for that type of spread. It's when you're sneezing and coughing, it's the sneezing and coughing that sends the particles out and because these hover a bit, that's what make it a little bit more likely to be easy to catch in a community setting.
Thank you. Dr. Pace, do we do any testing locally here, or can we?
So, great question. I mean, basically what's happened is the CDC has been very tight about testing because of supply of testing kits. It's getting rolled out now. They've worked out some of the problems, some of the kinks they had a couple weeks ago when they initially tried to roll it out more. They are now in the Bay Area, I think in Sacramento, so they're in a couple of the higher intensity places right now that are being used. We don't have them. They're not in Sonoma County. They're not. I think they might be in Marin, but they're not up this far yet. Probably over the next week, we're going to start getting capabilities where at least the regional labs have them, and then we can use them. Probably within a couple weeks to a month, there will probably be point of care testing like we do with flu and other things. But it's not because we're not asking, it's the supply coming down from above that's slowly getting rolled out to the areas where they're felt to be most at need.
Do they still have to be sent to the CDC?
At this point, the way I understand it, at this point, the people that are doing them locally can do the tests locally, but then any positives have to be sent to the CDC for confirmation. And at this point, anybody who gets a test, any patient who gets a test done has to meet the CDC criteria, or if there's an exception, they have to get approved by the CDC. So at this point, the approval of the testing strategy. So like if you said, well, I had contact with somebody who just came back from China and I want to get tested, you don't meet the criteria, the CDC wouldn't let it happen. It doesn't matter how much money you have. It's just, that's the way it is right now. This is quickly changing, and it's been a problem. I think this is part of the problem why we can't really have an understanding of just how widespread it is right yet, because we've only been testing people within these certain criteria. Quickly changing, probably if we have this conversation in 2 weeks, it'll be completely different, and it'll probably be available at least regionally, if not locally.
Thank you. Appreciate it.
Let me just, because the question about the Healdsburg school, so basically it looks like there were 2 cases that were identified in Sonoma County. What happened was, I guess at this small private school, one of the parents had contact with one of the cases, and so a decision was made Sunday night, I guess, to close the school today for at least temporary. It sounds like it's, they're probably trying to figure out what the strategy is going to be, because so conceivably the parent could be shedding the virus to their kid and then it could get into the school. So they're taking extra caution to try to limit the spread. So it's the same sort of strategy we're talking about trying to prevent it from spreading in the community.
Kavanaugh Hajanian. First question's for the PhDs. Regarding the asymptomatic incubation period, we've been getting mixed reports from the media. Some say 11 days, some say 25 days. What's the real figure? How long does that virus stay on a surface or in a human without?
So you're asking for the real figure, and I think the actual answer is that what we're learning about the virus changes from day to day. So currently, what we think right now is that if you were exposed to the virus, breathed it in, that you would become symptomatic if you were infected between 2 and 14 days. That's a long time. But if you go 14 days without having symptoms, then you're very, very likely to not have the disease.
So then there is a possibility that we have people in this county as we speak walking around with the virus and we just don't know it. Correct?
It's possible. Mm-hmm.
Right. Mm-hmm. Question for on down. Is there anything on the books regarding mandatory vaccinations, is that coming down the pike? Is there any sort of discussion in the state of emergency?
So there is no vaccine for this? So
Correct.
there's
For now. But
Well, there won't be for a year probably. So, I mean, there's no, that's not even on the
but
table right
flu
now.
shots, that sort of thing?
I mean,
what
that's,
I'm-
the flu shot doesn't directly protect you from the coronavirus. What the reason we're recommending the flu shot is because if you get the flu right now, it's kind of hard to tell what you have. And it's also, if you're sick with the flu and your immunity is sort of suppressed because of that illness, then you could be more vulnerable to the coronavirus. But there's no discussion about mandatory flu shots.
Okay. Moving on to the face mask issue. The media has reported that N95 filtration and or higher, and even full face respirators that have P100 filtration actually do filter out the virus. Is that incorrect?
Do you want to talk about that?
That is correct. The N95 respirator or higher, which would be, for us, we have what's called PAPRs, Powered Air Purifying Respirator. There are many different versions of it, but remember when I spoke about, and I probably did this because what it is it's actually a little compressor that blows air up through a hose over our faces and then out, and that prevents the airborne disease from getting in. But you can effectively do that with an N95 also, which has to be fit tested to you. If you go to buy one in the store, it isn't necessarily going to be fit tested to you. They are so specific, we are required to do it every year, to be fit tested every year, and if you have dental work, we fit test you again. If you lose a significant amount of weight or gain a significant amount of weight, we fit test you again. Yeah.
Facial hair is a problem with N95s.
Right. So to answer the essence of your question, yes, an N95 or higher respirator will protect you from an airborne disease.
Okay. And then lastly for Dr.
So, the other piece of your question, I think, is should you wear an N95 mask to protect yourself out in public or something like that? I mean, I think that's the question is out in public, should people be wearing this when they're concerned? So there's a couple different issues. One is there's a shortage of N95 masks right now. They're being used pretty quickly in some of the healthcare facilities where there are sick people with the coronavirus, and so the current recommendations are pretty specific about when N95 masks are indicated. The surgical masks are the ones we're recommending for people that are sick. So if you or somebody in your family has a cough and they're going out in public, we would recommend wearing a surgical mask, not an N95 mask, because they're much more available in the community. And they, as Teresa was saying, they prevent the droplets from getting out into the air and then getting spread. And so, but the N95s are used more for people that are in close contact. So right now, the recommendations are they're used for people that are in close contact with sick people that are known to or highly suspected of having the coronavirus infection, so that you're preventing it from coming in that way.
Okay, and then lastly is for Dr. Pace. Regarding your post on Facebook, you said that it was basically, at this time, isn't it affecting children? And the majority of the media reports I've read kind of concur with that. Is that still a fair opinion that children are more carriers and that the adults are more susceptible?
So most of the information we have is from China now. And, you know, information out of China is, you never quite know what to make of all that. But most of the information we have about this virus is from China, and they seem to have a very low incidence of kids getting it. In the United States, I'm not aware of any kids that have gotten it now. We don't know that they're shedding. You were saying, are they shedding? We don't know that.
We know that.
We've not tested them to do that. So they could be asymptomatic shedders, or they could be, their immune systems could be fighting it off, and we don't even know. So that's a question that let's talk again in 6 weeks and see what we know then, you know. So.
You can go ahead and come to the microphone. I know.
We won't be able to hear you.
Yeah, please.
I wish I had Lysol or something. Yeah, right? Okay, I've heard a lot
Just
about...
don't touch it, and
I
you're
know,
fine.
right, I'll just back up.
Yeah.
I've heard a lot about the tests and that we don't have enough of them. What about CT scans? I've heard those have been as effective, if not more effective, at locating this virus than the actual tests have been, especially considering the CDC kind of messed up the tests in the beginning. So why are we taking measures to test everybody that comes in that has similar symptoms with CT scans?
So anybody that has respiratory symptoms that are difficult to explain or that a chest x-ray doesn't explain might get a CT scan. But many of the lung illnesses that this virus causes are very similar to other types of illnesses that other viruses and other diseases cause. So the CT scan helps us direct what type of supportive treatment. It doesn't tell me whether somebody has COVID-19 or not. Does that make sense?
Right, and I think the other piece of that is the asymptomatic people will almost for sure have normal CT scans. So I think probably what you're thinking about is that people that are really sick, maybe they can tell by the CT scans that they're high risk for COVID-19, but people that aren't sick could still have it and not be showing any symptoms, and the CT wouldn't show anything, I don't think.
Okay, and one of my other questions is, we have a huge, Lake County in general has a pretty high senior citizen level, and I've heard that senior citizens are far more at risk, and even they become more critically ill than younger people. Basically 60 and over are pretty high risk. About 25% should end up in, need critical care. And that means like in our county, considering I did the math at home, about 4,900 people should become critically ill. Do we have enough beds to handle that? Obviously not all at once. And if not, what are we doing to slow down the spread of this virus? Are we going from place to place, like spraying stuff down now that we know that it lives on surfaces? Are we using chlorine and bleach to spray down county parks? I mean, what are we doing to be progressive instead of just kind of trailing behind the CDC, who I think has kind of been falling behind in general? Because it moves so fast.
So great, there's two parts of your question. One is how are we thinking about the elderly population and the most vulnerable population and working with them, and then the second part is the prevention question. So I'd say the first question is, you're absolutely right. It seems like from what the information we're getting, the elderly folks are the most vulnerable. One of the studies I saw that was out of China was that most of the people, so the people that got really sick, so they think there's about 20% of the people that get really sick and that need hospitalization, and a certain percentage of them need ICU care and ventilators. Those are the folks were 35 to 79 or something, but they tended to get better. There's been a couple of the deaths that have been in the US have been in that age range, but I think they all had pre-existing medical conditions. Then the folks that tend to be dying are the ones 80 and above. So you put them all, you do this aggressive care, ICU care. The older folks, the 80 and above folks, tend to be the ones that don't survive, and the younger folks seem to be able to keep it together long enough that their body fights off the infection and turn it around. Again, at this point, we are not aware of it being in the community. We're talking to the nursing homes. We're talking, we need to get out to part of what tonight is attempting to do is to talk to the community, but it'd be great to be talking to the senior centers and so I'm hoping to go do that in the near future here. And but it's, a lot of it is just trying to raise awareness and trying to help answer questions and trying to help people get strategies in place to prevent the spread, because there's really not any, I don't know about how to go about thinking about like spraying down the parks and stuff. It's totally, that's the right way to think, like, well, how can we do this? But that's really what a lot of this messaging is about here, is how to protect yourself and your family, to go in and talk to these institutions and see how they can do things. But if, yeah.
But if you don't mind me saying, isn't that like your job to consider setting up a program to spray around the community? We could talk all we want.
There's
isn't
not
that like
really
your guys' job?
Well, there's not really any indication that anything like that would help.
But SARS and MERS live on surfaces for at least 9 days. 5 to 9 days. And that means he touches this, I touch that, and then I touch my face, and I get it. And so, yeah, it becomes an issue, and I'm just thinking, kids especially, we don't know if they shed or not, but if they do, maybe we could be progressive in the progressive in this and kind of one step ahead of things, just to kind of mitigate the flow that I feel like our healthcare system will get if we all get sick at once. And it's an exponential growth that we've seen in China and Italy so far. I'm just looking at the data, and you know what I'm saying. I mean, maybe instead of just kind of following what everyone else is saying, maybe we could be proactive in it. Is there like a possibility that we could maybe?
Well, I think
what are we doing to be proactive?
Partly what we're trying to do is to educate folks and let them know, because I think really the way we think about this stuff from a public health point of view is that this is probably going to be out in the community, and it'll probably be more like the flu. We'll probably get a vaccine for it. We'll probably get some treatments for it over time, but it's probably going to be something that becomes part of the landscape of what we have to struggle with as human beings. And so it's probably not something that we're going to be able to eradicate. With the resources that are available and things like that, we are trying to work with it, and that's probably the way that we think about it.
Okay, and Remdesivir and Chlorinique, one more thing, sorry. Remdesivir and Chlorinique have been proven somewhat to help. I mean, is there any actual, to the doctors, are there any actual treatments for Remdesivir and Chlorinique, and if so, do we have enough of those treatments, or?
So right now, there is no known treatment that helps with the viral infection. And the CDC, their entire message and their entire approach is about prevention of spread. You can't rely on treatments or vaccines right now. And so right now in the public health is to educate people about what they can do to prevent from spreading it themselves and also to prevent from getting it. And that, from a public health perspective, is shown by evidence to be much more effective than what you were describing. Some things that sound like they make sense, when you actually study them, they don't make any difference at all. And so what's really important is in large organizations, hospitals, schools, public places, that the people who own them need to make sure that they are clean. And then for people in their homes, do what you can to keep any spread that somebody might bring in. Make sure that you're keeping things clean so nobody else gets sick if somebody does come in sick. And so these things work. They've been proven to work, and they seem really simple. And they rely on people being responsible, but like you said, people are reasonable, and they're simple. And the cleaners that you need to do are things that people use every day. It's a very easy virus to kill, very, very easy when it gets on a surface.
Okay.
Thank you very much for your questions. This is a yes or no question. Has there been any testing in Lake County?
No.
Thank you. If there was early testing, can it help keep the disease from getting more severe? If it was early testing.
I think so there's no treatment. So the part of testing from a medical point of view is if you get a positive test, what do you do with it?
Right.
What it would allow us to do, early testing would be extremely useful in my point of view. If we had availability for testing right now, so if there was a positive case in the area and we wanted to see if some of the healthcare workers that had contact with them were infected or not, we could test them and find out. We don't have that capability right now, so now we just isolate everybody, and for 14 days. Yeah. And it would be particularly useful in preventing spread because we could find out who's positive and who's not and work with it like that, like we do with some of the other testing. But in terms of treatment, there's not really any available, and the simple fact is the tests have not been. One of the things about testing that sometimes is people can be mad about the CDC for not rolling the tests out faster, but they're very concerned about accuracy. And so if there's a false positive test, so a test that turns positive that actually the person doesn't have the disease, it's very upsetting to the people in that community and everywhere else. So an example is one of the cruise ships, there was a person, so they didn't think anybody was sick on it. They started letting people off this cruise ship, and in Malaysia they did a test and the test was positive. So all of a sudden they had this concerned that the whole ship had been exposed, and so they scrambled around to do everything. Once they came to the U.S., they tested this person again 2 different times, and it was negative both times. So it turns out it was probably a false positive. So that's partly what the CDC is trying to prevent, is that sort of the commotion that gets caused with inaccurate testing.
Thank you. Yeah.
When we say that there is no treatment, that doesn't mean that we don't do supportive care for patients that come in that have physiologic needs that we can treat the symptoms for. We can't, there's no antibiotic or antiviral for coronavirus, COVID-19, but there's a lot of supportive treatment. That's how we make people better, right? That's how people survive it. And some people's immune system is strong enough that they can get well just with minimal supportive treatment and home care. So just saying, when we say no treatment, I want to just be really clear, it doesn't mean we can't take care of you if you get sick. We'll take care of you,
Okay. And the survival rate of this, or the mortality rate, is 2%. 2%. Do you have a question?
Yeah.
Thank you.
Do they have an antibody test yet for it? How long do you think it'll take for an antibody test? Do you think that'll come before the vaccine?
I haven't heard where they're at with that yet. They're really focusing really quickly on getting this kind of quick testing so that we can test it.
See how many people.
But yeah, it's a good question. I'm not sure where they're at with that yet, so I don't know.
Okay. That's all.
Thank you. I have a question. And could pets also spread COVID-19? Do we know that yet?
Not that we know of.
No, they don't know that. Yeah.
Not that we know of.
I'd just like to give another reminder that there's flu shots available and lots of hand sanitizer. Thank you so much. We have another question, please.
Actually, just a statement. Lynn Brooks from Public Health. It's real important, not just about touching surfaces, but touching your face.
Yes.
Where it gets in is through your eyes, your nose, and your mouth. And when we're touching things and then, getting up around our face, that's why people get a false sense of security when they think they're going to put on a mask. Well, you know as well as I do, you're fiddling around with it, you're touching around your face where the germs on your hands can get in. Plus, then your glasses fog up and you're rubbing in everything. And so, masking the person that's sick, super important. Washing your hands, using sanitizers, and not touching your eyes, nose, and mouth with dirty hands. Okay, so that, as far as education, really super important. Okay, thank you very much.
Thank you.
Thank you. There were several questions about the schools. Could you sum up again what you previously said about schools and what they're doing to handle this? Thank you very much.
So one of the first things, when things like this come out, we go into universal precautions that we're already, for the most part, a lot of these things are already being done on a year-round basis, but then we emphasize them. So going through and making sure that all surfaces are clean, room surfaces, earphones, keyboards, play equipment, athletic equipment in some cases. We heighten our cleaning schedules. Maybe we would start doing it more than once a day, things like that. Teachers can start to screen for kids, so if somebody starts coughing and things like that, they could be identified and sent maybe to the school nurse. There's different levels that we implement depending on where we're at with staging with public health and things like that. Of course, then good hand hygiene is a popular one. I know as many have said here, I know AmeriCorps program goes into our preschools and does a lot of lessons. One of the lessons is germs and how to wash your hands, and they sing the happy birthday song twice in a row as they're washing their hands and going through that type of thing. And so we start doing a lot of lessons around that at the preschools. Other sites, again, hand washing, making sure the kids know the proper ways of hand hygiene, hand washing, things like that. Coughing into your elbow, coughing into tissues, the Dracula cough, we make all sorts of names for it. That way the kids can remember it. But those are just some of the universal things that are put out there, making sure that all doorknobs are getting wiped down, all common surfaces, things like that. Also, there's a lot of things around just communication, and so then when we go into the data part of it, making sure that we're keeping a close eye on school attendance. I know I referenced H1N1 quite a bit because that was one of the first protocols that we put in place was to make sure that we were monitoring school attendance. We actually had one school in our county that had a huge drop in attendance one day. And at the time, Dr. Tate was here, and we thought, oh my gosh, we're going to have to start looking at school closures. But when we started calling home to see what was going on, if it was flu-like symptoms or anything like that, we found out a majority of students stayed home because of fear. Others had other issues that were going on. It wasn't flu-related symptoms at all as we were going through it. But we do, at certain stages, it can trigger that where our schools start calling home just to find out more information about why students, or why staff in some cases, might be missing school as we're going through.
Great, thank you. We have another question from the community here.
Yeah.
Thank you.
I got a few, so I hope you'll be patient. But so one of the probably easier ones and more cheerful ones is, do we have a pretty good idea after one of these virus-infected droplets lands somewhere, how long it's going to live out there, be able to infect us?
What I've heard is it's kind of, the thinking is a couple hours, but it could be anywhere up to 24 or longer. So there's still, the evidence isn't really very good yet, so.
But you're thinking in hours, not days, huh? Because I mean, I'm reading stuff where it's days. But
I don't think anybody knows yet, but that's,
okay, so good.
that's, I mean, the good news is it's easy to kill. Like Dr. Page was saying, it's with normal disinfectants, it seems to be pretty easy to kill, but I have not seen good data on that.
Is it reasonable to expect that there will be some kind of seasonal end to this novel coronavirus, sort of like we have a seasonal end to the common cold or the normal influenza?
I think it's reasonable, but we don't know.
Yeah, there's no telling.
Mm-hmm.
So, okay.
There's cases in Riverside County, and they have their climate mimics spring.
I mean, right now in China, there's a decline. I mean, already it's declining there. So that tends to be the way many, like you were talking about SARS and other viruses, they tend to come and then they tend to go. But we don't want to say that this is going to behave that way because we don't know.
Okay. That's what I suspected. So sort of back to the quarantine protocols. And I'm a little confused by this, this question is really going to how that would affect staffing in all of your professions. Particularly, I can see that Sheriff Martin, say your deputies are out and you're wrestling with somebody, and then you have a suspected exposure, and you don't have test kits. I think you're supposed to then quarantine those personnel. I mean, it seemed to me that that would really be disruptive to staffing and with all of you. And then it made me think, I know the term for Sheriff Martin, mutual aid. How does that come into play? Like either our people would be called over to Sonoma County to help them, and or would you have people to help us? And then it also would apply, I'm sure, in the Sutter system, and then also in the fire people, I imagine also.
I have a situation in regard to that too. I'm aware of the fire service in general in regard to that.
Jim Dowdy has got a very good answer for this, but I agree, yeah, absolutely. And these are some of the things that we're concerned about, and we're preparing for it. We have a finite number of people, and we would love to keep 100% of them available, healthy, keep their families healthy so they can provide these services. But the reality is if one of them gets exposed to something, it's probably going to take them out of the game for a couple weeks. So that's the whole reason why we're here to talk about all this.
And the quarantine protocol now is 2 weeks, right? Isn't that? And that's with
14 days from last exposure.
And that's because we don't have the test kits. If you had the test kits, then that might be shortened, right? Okay, good.
So they've, in Washington, they have 25 firefighters that have been quarantined due to being in contact with a care facility where there was an outbreak. And then they had 2 cases in LA, Orange County, where a crew had, took themselves out of service and quarantined, and then they brought in other crews to cover those stations. So mutual aid is typically what you would do in regard to that, but if there is an exposure in regard to, they're going to have to be quarantined, and then you're just going to bring off-duty staff and mutual aid in as needed to backfill for that. In our cases, and exposure-wise, you're probably going to have a small amount of people exposed to that, so it wouldn't be, maybe 1 or 2, 3 people exposed to that individual. So
Seems locally that more likely would be called away somewhere else to help them. One
What's
of the
that?
we more likely our people would be called away to Sonoma County or the Bay Area or somewhere, some of these other hot spots.
So there's, through OES, through the Sheriff's Department, through OES and the fire departments, if there is a mutual aid plans in place for large incidents, whether we assisted with the, years ago with a bus accident over in the valley. We sent a strike team of ambulances over there. During the fire season, we brought up AMR and different ambulance companies brought up strike team ambulances to cover our counties. So in the public safety aspect of it, in the fire police, we have a lot of, we work together quite often, and we have the ability to, in a short period of time, to bring in resources to backfill and behind them. So, and even like in the where they just had the 2 firefighters' deaths down in Fresno, they brought in firefighters from Bakersfield to cover those stations so they could attend the funeral services for that. So they worked together pretty well.
And how about in the Sutter Health System?
So we've had very, very similar setups. We've had experience with that. Unfortunately, we've had a disaster every year for about the past 5 years with the fires. Many people haven't been able to come to work because they needed to be home for whatever reason that was due to the fires. And so the SHEMS, the Sutter Health Emergency Medical System, was always activated then, and often would send people to us that we needed.
That's the beauty of that system. We tell them what we need, and they try to, and it's amazing when there's a disaster, the system, people in the system want to come help. So we haven't had a problem being able to get the staff support we needed, nurses, providers, techs, whatever we need, we usually are able to get. Let's hope that stays that way.
Thank you.
Thank you.
These systems that we're talking about, these emergency management systems, whether it's SHEMS or it's NIMS or SIMS, they all have the factor built into them that's we refer to as scalability of operations. So as these things grow, we're able to scale up those operations. Those mutual aid protocols are in place, so the availability of resources as these things grow. So right now we're at a situation where we're not going to. It's not going to look like the movie Outbreak because we're not there. If we get there, maybe things will change, but those resources and systems are in place, scalable operations. To compare it to something that we're all familiar with here, if we have a small half-acre, 1-acre fire, we have a few resources come, and when that fire gets big and out of control, that's when you start seeing these other resources come in. Right now, we don't have anything to indicate in Lake County that, that we have this. There's a potential and a possibility that we will. We hope that we'll keep it small and our response will be scaled to whatever the situation dictates.
Thank you. Thank you. Real quick, I'd like to, if you could just recommend some disinfectants that make
so yeah, we were just reading an article, and I probably could give you the reference but there's an article I think that was published by Medical Economics, and it was a list of 139 over-the-counter disinfectants that worked. So there were very common names in the list, like Pine Sol, Lysol, Purell, but what you want to do when you buy one is look at the label, and if it says it kills viruses like the coronavirus, which it will say, because again, coronavirus is a very common cold virus. It's a type that it will work. So the key is whatever you buy, there's I think 139 might be almost every disinfectant that might be out there. So look at the label, and then follow the instructions on the label about how it tells you to clean. Often one of the mistakes people make when cleaning a surface is they'll wipe back and forth, and sometimes you can be wiping the virus back and forth, so you're just supposed to do one sweep, and then it often has a wet time, and it will tell you how long you need it to let it air dry. And usually it's 30 seconds to a minute, and that can seem really long sometimes. But anyway, make sure that you follow the instructions. Sometimes they vary from product to product.
Is there a percentage of the alcohol that we should be looking for?
Just look at the label.
So Tammy says percentage of the alcohol in your hand sanitizer should be
60 to 90%.
And then the other thing I just wanted to point out is, if it says 30 seconds, it doesn't mean don't touch it and let it dry for 30 seconds. It means that's the dwell time of the liquid solution. So it should stay wet for 30 seconds. So if it's not staying wet, you keep wetting it down for 30 seconds and then you let it dry. And you don't dry it with something else. It has to air dry because that's when it's killing any bad stuff.
Thank you. Has FEMA set up any emergency program?
Where this is going through right now is the CDC. So, and I think Homeland Security, so I'm not sure exactly what that question is getting at, but as far as I know, the CDC and the president and Mike Pence now is sort of in charge of the responses, and they're dictating FEMA and the CDC, but the CDC is really the one who's sort of dictating the response, and then when they figure out, maybe they're thinking about kind of quarantines and things like that, but that's all at the federal level.
Thank you. So another question, and I'll go ahead and ask it or answer, is washing your hands a good preventative? And yes, wash your hands. We were showed today this evening how to wash hands. And also to the question, my husband has been sick a few days, has a sore throat, and 3 days a dry cough. Call the doctor, let him know exactly what the symptoms are, and go see the doctor. Are there any questions in the crowd that can be?
This is for Sheriff Martin, but what do you do if you have an incarcerated person that is positive for the virus? They probably got it from somebody visiting, or I'm not sure, but do you have a protocol for that?
Yes, we have protocols in place for communicable diseases. We have people that are in custody that have that will sometimes come in and test positive for tuberculosis. It's very similar in that it's an airborne transmitted disease. So we have rooms set up with, I think the term is called negative pressure. So where air is drawn into there, there's no air coming out of the room, and the air is blown out through a filter system to catch any possible viruses. Our staff is, when they're in contact with people that test positive for any communicable disease that's spread by way of air, they don personal protective equipment. We have our own medical staff on contract that is very well educated in handling these types of things. So we are equipped to deal with it. As I said earlier, if we had a small number of people that were quarantined and refused, we got a place for them. I know everybody in jail would rather be at home, so we would encourage them to abide by the quarantine so they could stay home. But if it comes down to it, we do have the facilities to accommodate some people.
Okay, thank you.
Is there an RO number?
Yeah, so that's an epidemiology question. So that's the question about infectivity, how many people get infected by the typical case. And my understanding is it's 2.5 at this point. That's the one they're thinking. So measles is much higher. That's the number I've seen batted around.
I mean, just taking China's draconian measures and it's still spreading, do you really believe it's still 2.5?
I don't.
That's the information that's available now for us. And one last question, excuse me, is there's concern about the number of commuters working in neighboring counties. Why have there been no tests performed in the county? And if you could just say very quickly why, and then we'll have to end that tonight with that question, please.
Yeah, I think the testing question goes back to what we've talked about before. There's just been, it's a new virus. They've not really had testing available for it. They've actually done a pretty good job of ramping up this testing strategy. Now the CDC was trying to control it. Now it's going out into the private and the academic settings, and so there's probably going to be a bunch more testing available here in the near future, and it's going to change the whole discussion. This discussion about infectivity, we'll know a lot more when we can test. Right now, we don't know. We're not really testing it. And so the question about commuters is, the whole thing about mobility in the modern world is partly what's driving these kind of infectious outbreaks. And we're not likely to change that anytime soon, although some of the control measures are trying to do that. And I think the general overriding message here is This is changing day by day. You know, the people that are working in these fields are doing the best they can to keep on top of it and trying to stay in front of it. And I think people are going to have a lot of questions. They're going to read the news and hear some of the things that are going on. It's going to be very anxiety provoking. It's going to raise a lot of questions about, you know, can I go on my vacation in a month? How do you think through all these things? There's no right answer. We don't really know. We don't know where we're going to be in a month from now. But it seems to be moving kind of quickly. We're still very low risk in Lake County. You can take some measures for yourself personally, for your business. Planning is a good thing, and you know, we'll keep trying to keep putting information out as much as we can so that people will be able to stay informed.
Great. I want to thank you very much, all of you, for being here tonight, this late evening. Everybody in the crowd, thank you for your questions, and please keep being informed the best you can. Wash your hands. Thank you very much, and have a good evening. Thank you.